What's up, everybody? I am just pinning a comment real quick, and we will go ahead and get going. Walker is here. It's called Okay, hello everybody. My name is Corey, and I use he, him as pronouns. In the past few months, Whitman-Walker's community health team has expanded its outreach efforts to social media platforms. We cover various topics about HIV, STI, sexual health practices, access to care, social terms of health, public health interventions. The community health team, of course, is here to support you. Today, I will be discussing the stages of HIV infection. The first one is acute HIV infection. Acute HIV infection is the earliest stage of HIV infection and is generally developed within 2 to 4 weeks after infection with HIV. During this time, some people have flu-like symptoms such as fever, headache, and rash. In the acute stage of infection, HIV multiplies rapidly and spreads throughout the body. The virus attacks and destroys infection-fighting CD4 cells or T cells of the immune system. During the acute HIV infection stage, the level of HIV in the blood is very, very high, which greatly increases the risk of HIV transmission. A person may experience significant health benefits if they start ART during this stage. So in the acute stage of HIV, there's a lot of health benefits to starting antiretroviral therapy or ART in this acute stage. The next is chronic HIV infection. The second stage of HIV infection is chronic HIV infection, it's also called asymptomatic HIV infection or clinical latency. During this stage, HIV continues to multiply in the body, but at a very low level. People with chronic HIV may not have any HIV-related symptoms without ART or antiretroviral therapy. Chronic HIV infection usually advances to AIDS in 10 years or longer, though in some people it may advance faster. People who are taking ART may be in the stage for several decades. So while it's still possible to transmit HIV during this stage, people who take antiretroviral therapy exactly as prescribed and maintain an undetectable viral load have effectively no risk to transmitting HIV to an HIV negative partner through sex. And then the final step of the virus is AIDS. AIDS is the final, most severe stage of HIV infection. Because HIV has severely damaged your immune system, the body cannot fight off opportunistic infections. And opportunistic infection are infections and infection-related cancers that occur more frequently and are more severe in people with weakened immune systems than in people who have a healthy immune system. People with HIV are diagnosed with AIDS if their CD4 count goes less than 200. If they have a certain opportunistic infection, once a person is diagnosed with AIDS, they have a high viral load, and are able to transmit HIV to others very easily. Without treatment, people with AIDS typically survive about 3 years. Yeah, so that is the stages of HIV. Of course, I know a lot of people have heard them before, but it's always good to reiterate them so people are aware about what's going on, especially with the new findings of the virus and things of that nature. But before we go, of course, we want to give you some reminders of COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself and your loved ones and communities from illness. Variants are soaring across the United States at the moment. It's totally understandable why you want to keep wearing your mask, because the vaccination is not 100% effective. More contagious variants are spreading, and there's very few protocols to find if someone has actually been vaccinated or not. If you haven't been vaccinated and you're looking for an appointment, of course, Whitman-Walker Health has COVID-19 vaccines available. Everyone 5 years and up is eligible for the COVID-19 vaccine. You can reach out to us at 202-207-2480 to make an appointment. If you're having trouble, for DC residents, you can find more information on COVID-19 vaccine and walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. You can track the speed of COVID-19 vaccination lines while visiting coronavirus.dc.gov/don't wait. If you live in Maryland, you can find out about a distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, you can visit a vaccination portal here. If you live in Montgomery County, you can visit a vaccination portal or call 240-777-0311 to schedule an appointment. For Virginia residents, you can learn more about their Virginia vaccination process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you have not been vaccinated and you're not looking for an appointment, please make sure that you're following CDC's guidelines to mask wearing and social distancing, quarantine, and the like. It is very important that you do consider getting COVID-19 vaccine and to make sure that you discuss precautionary measures with those around you. Be mindful of mask and keeping your distance, especially when you're not sure if a person has been vaccinated or not. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker. And always check our website at whitman-walker.org for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. Follow some of our programs at Whitman-Walker Family, at Real Talk DC _ and at No Filter DC. Y'all have a great day. This was HIV 3 stages. And y'all have a great day.